All right, today we're going on a tour, but not of some exotic city. Nope, we're going inside the human body, to the very battlefield where your immune system fights off all those nasty colds and coughs. Let's get right into it.
You know that feeling, right? The sniffles start, maybe a little bit of a fever, and you just feel off. We've all been there. But have you ever stopped to think, what is actually happening inside my body right now? And what's the real difference between just a common cold and something that could be a lot more serious? Well, that's exactly what we're going to unpack today. Okay, so think of this as our map for the tour. It shows the entire layout, from your sinuses way up top, all the way down to the tiniest little air sacs in your lungs, the alveoli. And you can see how it's all one big connected system. That's key, because an attack on one area can easily, and I mean easily, spread to another.
So to make this whole thing easier to understand, let's use an analogy. Imagine your respiratory system is a two-story house. You've got the upper floor and the lower floor. And trust me, where an infection decides to set up shop, upstairs or downstairs, makes a huge difference.
So here's the breakdown. The upper respiratory tract, that's basically the upstairs of the house. It's everything from your voice box or larynx on up. So we're talking your nose, your sinuses, your throat. This is where most of the common stuff, the everyday colds, happen. Now the lower respiratory tract, that's the downstairs. Everything below the larynx, your windpipe, your bronchial tubes, and of course, your lungs. And yeah, when you've got trouble on this lower floor, things tend to be a lot more serious.
All right, let's start our tour upstairs on that upper floor. This is ground zero for most of those sick days you take from work or school. We're going to talk about the big three: sinusitis, ear infections, and, you guessed it, the classic sore throat.
First stop on our tour, sinusitis. So, you have these air-filled pockets, or cavities, inside your skull. Those are your sinuses. And when they get all angry and inflamed, that's sinusitis. Fun fact, since it almost always happens at the same time as a runny, inflamed nose, a lot of doctors actually call it rhinosinusitis. It's a mouthful, I know, but it's more accurate. So, how do you know if you have it? Well, we've broken down the symptoms into three main categories here to make it easy. First up, you've got the pressure. That awful feeling of fullness or even pain right in your face. Then there's the drip. Yeah, that lovely nasal discharge. And finally, the blockage. Good old nasal congestion. If you're checking those boxes and you've also got a headache or a fever, well, you're probably dealing with sinusitis. Okay, now this next point is absolutely crucial. So listen up. The vast majority of the time, sinusitis is viral. Yep. It's caused by the exact same viruses that give you a common cold. Remember that, because it's going to be super important when we get to the part about treatments a little later on. All right, moving on. Next stop on our upper floor tour is just a short trip away, the ear. We're going to look at something called otitis media. It sounds complicated, but it's really just an infection of the middle ear, that tiny little space right behind your eardrum.
The number one sign here? A really sharp, nasty ear pain. Your hearing might get all muffled, like you've got cotton in your ears. And it usually shows up right after you've had a cold. And here's a weird twist. Sometimes the pressure builds up so much that the eardrum actually ruptures. And when that happens, you can feel this sudden, strange relief from the pain, which is then followed by fluid draining out. Kind of crazy, right? Okay, time for our final stop on the upper floor, and this is a big one. We're talking about the sore throat. And this always leads to the million-dollar question, the one we all ask. Is this just some random virus, or could it be strep? So let's look at the evidence. A viral sore throat, right, usually brings friends to the party. You'll have other cold symptoms, like a cough or a runny nose. But bacterial strep throat, that's a different beast. It tends to hit you like a ton of bricks, suddenly with a high fever. You might see those giveaway white spots, which are called exudates, on your tonsils. And here's the big clue. You typically don't have a cough.
So how do doctors figure this out? Well, they have a tool for this, a kind of checklist called the center criteria. It's like a 4-point inspection. 1. Is there a fever? 2. Do we see those white spots, the exudates? 3. Are the lymph nodes in the neck tender to the touch? And 4, and this one's key, is there an absence of a cough? The more of these boxes they can tick, the more likely it is that they're dealing with strep.
Okay, we've covered the upstairs. Now we're heading down to the lower floor, and this is where things can get a lot more serious. When an infection migrates from your head and throat down into your chest and lungs, the stakes are definitely higher.
And we're talking about pneumonia.
See, this isn't just about inflamed airways anymore. No, this is an infection of the lung tissue itself, what's called the pulmonary parenchyma. This is the delicate, essential tissue where the magic happens, where oxygen passes from the air into your bloodstream.
And wow, you really don't need a medical degree to see the difference in these x-rays. Look at the left. That's a healthy lung. It's dark, which means it's full of air just like it should be. Now, look at the image on the right. See that cloudy white patch? That's the pneumonia. That's inflammation and gunk and fluid filling up all those little air sacs, literally blocking them from doing their vital job.
And the symptoms you feel, they totally reflect this serious battle going on inside. It's not just any cough, it's a deep cough, one that brings up stuff, or sputum. You'll get the fever and fatigue for sure, but you also get signs that your lungs are really struggling. Things like a sharp pain when you breathe, really fast and shallow breathing, and even your oxygen levels can start to drop. So how do we fight back against this? Well, if we're talking about a bacterial pneumonia that you picked up out in the community, and it's considered a mild or moderate case, the first line of defense is usually a pretty straightforward oral antibiotic, something like amoxicillin.
But, and this is a big but, if the pneumonia is severe, the game changes. Treatment gets escalated, big time. This means a trip to the hospital, where you'll get much stronger antibiotics delivered directly into your vein through an IV. The goal is to get that powerful medicine into your bloodstream to start fighting that infection as fast as humanly possible.
Which brings us to the big picture. This is it. If there is one thing you take away from our entire tour today, let it be this. It all boils down to the huge question of antibiotics.
So, after everything we've just walked through, from a stuffy nose with sinusitis all the way to a serious lung infection like pneumonia, let me ask you this. When you start feeling sick, is your first instinct to reach for an antibiotic? And is that actually the right move? Okay, here is the absolute bottom line. The crucial takeaway is this. Most, and I mean most, common respiratory infections, your colds, the flu, the majority of sore throats, and sinus infections are caused by viruses. And antibiotics, they have absolutely zero effect on a virus. Zilch, nada. They only kill bacteria. So using them when you don't need to doesn't help you get better one bit, and worse, it actually fuels the huge global problem of antibiotic resistance. Look, knowing this difference between a virus and bacteria, that's not just trivia, that's power. It gives you the power to have a smarter conversation with your doctor. It helps make sure you're using the right weapon for the right fight. It makes you a partner in your own healthcare, not just a passenger. So I'll leave you with this question to think about. The next time you're feeling under the weather, what will you ask your doctor?